Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is what you need to know about fibromyalgia. Fibromyalgia is a connective soft tissue disease that involves chronic, spontaneous, and widespread musculoskeletal pain, as well as recurrent fatigue and sleep disturbance. The condition presents multiple tender spots on the body that are typically found on the back, neck, chest, hips, arms, and legs. It was previously referred to as chronic pain syndrome or psychogenic rheumatism or fibrositis. 3.4% of women in the U.S. and 0.5% of men have fibromyalgia. So 7 times more women than men have it. The typical age range of presentation is 30 to 50. 3/4 of those who have it actually go undiagnosed. The American College of Rheumatology has guidelines that include history of several areas of aches or pains for a minimum of 3 months, having at least 11 of 18 locations on the body that are significantly tender, and if it's close to the diagnosis but it's not quite, it's called myofascial pain syndrome, and it has the same treatment. Here's a diagram of those 18 trigger point areas: neck, shoulder, elbow, knee, top of the thighs, buttock, and then all around the neck and shoulder area. So JAMA came forward in 1987 with major and minor criteria. The major ones include generalized and chronic aches and pains or stiffness for over 3 months in 3 or more anatomic areas, multiple tender points at characteristic anatomic points, and then no other identifiable condition that the symptoms could represent. The minor ones include generalized fatigue, chronic headaches, neck and shoulder pain, sleep disturbances, bowel irritability, and then subjective numbness and swelling. Oftentimes, it becomes a diagnosis of exclusion. The pain management doctor will go through a whole series of potential differentials of what it could be, and then if it doesn't quite fit, then it becomes fibromyalgia. So what are the treatment options? Mayo Clinic came out years ago with alternative medicine options, which they thought worked really well. This would include acupuncture, chiropractic adjustments, physical therapy, massage, aromatherapy, homeopathic medicine, spa, baths, relaxing herbals, music therapy, and yoga. When you start looking at conventional treatment options, medications include antidepressants, analgesics like NSAIDs, muscle relaxers, Tylenol, opiate medications, potentially Lyrica or Neurontin, sleeping aids, and then there's also a Myers cocktail IV infusion treatment. There are some FDA-approved medications. One is Lyrica. It was the first one in 2007. Cymbalta was the second one in 2008, and there is a third one, Savella, in 2009. It's interesting. We don't know how any of these medications actually work. We just know that they work well for fibromyalgia. How well do these treatments work? In a 2009 pilot study for Myers cocktail, most subjects experienced relief as compared to baseline, but there was no statistically significant difference. They just needed a larger study to show the statistically significant difference. It's a very popular treatment. There's really no risk to it, right? I mean, it's just an IV treatment of minerals and vitamins and things, and it's been shown to work really well. There's no cure for fibromyalgia. It's a very challenging condition. The National Fibro Association has said that these new studies show patients can decrease symptoms dramatically through multimodality treatment, such as including the alternative with the conventional treatment options. The top non-operative pain management in Florida is through the Florida Pain Network. There are many clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified, award-winning doctors. In the Tampa area, visit us online at painmanagementtampa.com and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.